Hello and welcome back. I'm Physician, and if you've ever ended your day with tired, heavy legs or noticed your feet feeling cold, even when the rest of you is warm, today's video is going to matter to you. Poor leg circulation is one of the most common complaints I hear from patients over 60, and yet it's rarely talked about until it becomes a serious problem. So today, I want to walk you through exactly what's happening in your legs when circulation slows down, why it matters more than you might think, and one simple exercise you can start doing today that can meaningfully improve blood flow in your lower body. Let's start with the basics. Your heart is a powerful pump, but pumping blood down to your legs is the easy part. Gravity helps with that. The harder job is getting that blood back up to your heart. Your leg muscles, especially in your calves, act as a secondary pump. Every time you walk, flex your ankle, or contract your calf muscle, you're squeezing the veins in your legs and pushing blood upward back toward your heart. The problem is, as we age, we naturally move less. Maybe you're sitting more, whether it's watching television, working at a desk, or simply resting more than you used to. And when those calf muscles stop doing their pumping job, blood can start to pool in the lower legs. Over time, this can lead to swelling, achiness, varicose veins, that heavy, tired feeling by the end of the day, and in more serious cases, it can contribute to blood clots. Now here's the encouraging part. Your circulatory system is remarkably responsive. Unlike some parts of the body that we take months or years to show improvement, blood flow can respond within minutes of movement. That's why the exercise I'm about to show you is so effective. It directly targets that calf muscle pump I just described. I call it the seated ankle pump and calf raise combination. And the beauty of it is you can do it sitting in a chair, standing at your kitchen counter, or even in bed. You don't need any equipment, you don't need to get on the floor, and it takes less than 5 minutes. Here's how to do it. Start by sitting comfortably in a sturdy chair, feet flat on the floor. First, we're going to do ankle pumps. Lift your toes up toward your shins as high as you comfortably can, hold for a count of 2, then push your toes down toward the floor, pointing them as if you're pressing a gas pedal. Repeat this up and down motion 15 times. Feel your calf muscles gently working with each movement. Next, we move to the standing calf raise. If you're able to stand safely, hold on to the back of a chair or a countertop for balance. Slowly rise up onto your toes, lifting your heels off the ground as high as comfortable, then slowly lower back down. Do this 10 to 15 times. If standing isn't accessible for you today, you can do a modified version, seated, simply lifting your heels while keeping your toe on the floor, pulsing up and down. Finally, finish with what I call circulation circles. Lift one foot slightly off the ground, rotate your ankle in a full circle, 5 times clockwise, 5 times counterclockwise. Then switch to the other foot. This helps mobilize the smaller vessels around your ankle joint, an area that's especially prone to pooling. That's it. Ankle pumps, calf raises, and ankle circles. 3 simple movements done in sequence take about 4 to 5 minutes total, and I recommend doing this routine 2 to 3 times throughout your day, especially if you know you'll be sitting for extended periods, like during a long car ride, a flight, or an afternoon of reading or watching television. Why does this specific combination work so well? Because it targets multiple points along your leg's venous return pathway. The ankle pumps activate the smaller veins near your feet and ankles. The calf raises engage what's often called your second heart, the calf muscle pump, which does the heavy lifting of pushing blood upward. And the ankle circles help keep the joint itself mobile, preventing the kind of stiffness that can restrict blood flow at that bend point. I often tell my patients to think of it like this. Every time you contract that calf muscle, you're essentially giving your veins a gentle squeeze, encouraging blood to move in the right direction, back up toward your heart, instead of settling in your lower legs. Now, a few important notes. This exercise is a wonderful daily habit for supporting healthy circulation, but it isn't a substitute for medical care if you're experiencing specific symptoms. If you notice sudden swelling in one leg, especially if it's accompanied by pain, warmth, or redness, please contact your doctor promptly, as this can sometimes indicate a blood clot that needs immediate attention. Similarly, if you have open sores on your legs or feet that aren't healing, persistent numbness, or skin discoloration, these are signs to bring up with your physician rather than address through exercise alone. For most people dealing with the common, everyday version of poor circulation, the kind that shows up as tired, achy, or swollen legs after a day of sitting. This routine can make a real difference when done consistently. I always tell my patients that consistency matters more than intensity here. Doing this gentle routine several times a day is far more effective than doing an intense session once a week. A few other habits that support what we're doing today: try to avoid crossing your legs for extended periods, as this can restrict blood flow at the knee. Elevating your legs above heart level for 15 minutes in the evening can also help drain pooled fluid, and staying hydrated supports healthy blood volume and circulation overall. I'd love to hear from you. Try this routine today and come back in a week to let me know how your legs feel. Are they less heavy by the end of the day? Do you notice less swelling around your ankles? Drop a comment below and share your experience. If you found this helpful, please give this video a thumbs up, subscribe for more practical health guidance, and share it with someone in your life who spends a lot of time sitting. They'll thank you for it. Take care of your legs, keep moving.